Welcome to Focus on Seniors, a television show sponsored by Helping Seniors of Brevard County, Florida. The show is designed to make you aware of senior issues, needs, and resources available to help us age in place and with dignity. This show will help you as you develop your own aging and care plan.
I'm Joe Steckler. Welcome to Focus on Seniors, the television arm of Helping Seniors of Brevard County, a show designed to provide you with information on how to develop your own aging and care plans. Our topic today is dental care for seniors. And with me in the studio is Dr. Lee Sheldon of Solid Bite Dental Implants, but Lee is also a periodontist. And your specialty and what you do leads to some improved care, I think, for senior citizens.
I'd like to think that the things that we do in the mouth directly influences the rest of the body, which is kind of a new concept for some. You know, we kind of cut everything off of the mouth. The dentist is in charge of the mouth, and physicians are in charge of the body. But, you know, realistically, how could there not be an interaction from one to the other? And what's occurred over the past several years is we're seeing more and more links between chronic dental disease and chronic degenerative disease in the body in general.
Lee, when I was, let's go back to 1986. I was the commanding officer of the Navy Retirement Home in Gulfport, Mississippi. And I had 3 dentists that worked for me over there. And my senior dentist was a retired Navy captain. And started the philosophy back in those days, because the people in the home, there were 550 people that I took care of. I had a 60-bed hospital, a 57-bed assisted care floor. Here I am, a submarine officer, taking care of all those people. Yeah. And our average age was 77, and at the time I was 52. But I learned a lot about aging and having really good programs to help people. But back in those days, the thought was, if a person in their 80s or 90s broke a tooth or something, we just put a stainless steel cap over it. We didn't even put a crown, we put a cap on it.
Yeah.
And I'm sure that was probably a general practice maybe in the civilian community too. I don't know.
That was a cost-saving measure, John.
It's cost-saving.
Yes, we don't, even at that time, we were not putting stainless steel crowns on people. We do that as an inexpensive way of trying to help somebody out.
Yeah, but today, and also back, a lot of times you see people with very, very poor mouths.
Yeah.
And you still see it today. If people neglect their mouth, they'll do that.
It's a big part of my practice.
Yeah, but we have the capability now to restore the mouth to where if our mouth feels good, the rest of our body feels good too.
Oh, it's true, and I've got countless stories of that. It was only yesterday that I gave a little talk and demonstration at our office, and what was great, it was really gratifying, is that my first teeth in an hour patient showed up, and he surprised me by showing up. So here's 38 people coming into the office to find out what can be done for the badly debilitated mouth, or for the person who has dentures and just can't stand the idea of dentures anymore. And here he comes in, and he talks to them. And of course, he's been a patient of mine for years.
But what was his first thing? What did you do to him?
I did something called teeth in an hour.
Oh, teeth in an hour.
So that means on the same day, we put in his dental implants and put his permanent teeth in all at the same time. We don't do it quite the same way now as we did then, but it's the thing that you see advertised on TV all the time.
I know.
Get teeth on the same day.
But
I'm very proud. I was the first one in all of Central Florida to do that.
Okay, you're proud of it, but I'm going to make a guess, educated guess.
Go ahead.
I bet that man had a pretty healthy mouth for you able to do that one day.
First of all, he didn't, and that's the interesting part of it. First of all, how could he have had a healthy mouth if he lost his teeth?
But if his mouth was bad,
yeah,
how could his bone structure be enough? You had to put at least 4 implants in.
That's right, I did. And essentially what he'd done, let me tell you his story. He had lost his teeth about 11 years.
How old was he?
At that point, he was 78, I believe.
Okay. Senior citizen. Okay.
That's right. And he had lost all his teeth 11 years previously, and he had all of his upper teeth, and he had an upper denture. And he had lower natural teeth, which had some gum disease, and we were able to get that fairly well under control. And his comments are, my upper teeth, they just didn't feel as if they were part of me. And ultimately, when I got the teeth extracted, all right, at least I was rid of the bad part. I can't talk about this in dental terms or medical terms. I'm talking to you about what he said to me. And so we wore an upper denture, and of course the upper denture covers the roof of the mouth. It's held up on the upper like a suction cup, and you can't taste your food as well because there's plastic over the roof of the mouth. And so he was suffering from all of those things. And what he did was go to my first dental implant lecture years ago, and we developed a relationship. And then when we got the technology of this particular doing everything in one day, which really, by the way, isn't done in one day. We do the surgery and the teeth in one day, but the planning took 3 months before we finally got to that magic day where we put the implants in and put the teeth in. So for those of you who are watching the commercials, understand that yes, it is all done in one day, but it takes a long time to get to that day. And he agreed to be my first teeth in an hour patient. So we did that, and the surgery went very well. And of course, there was video going on, and there were 2 dental offices with assistants going on, and a lot of people in the room because it was a big deal at that time. It's not as big a deal now because we've been doing it for a long time. And then, of course, I've talked with him over the years. But what he said yesterday was really incredible to me. First of all, he gave me the statement that sometimes the teeth don't belong in your mouth. But the second thing he said was, once I had my upper teeth restored with dental implants, with teeth in the dental implants, my lower teeth got better. They felt better to me. The guy's a healthy guy. He does take care of himself. But it's amazing how you can lose all of your teeth in one arch and keep all of your teeth in the lower arch perfectly healthy, and he felt he was more healthy as a result of having upper teeth.
That's no way to live.
No,
it really isn't. So I'm thankful that there are things we can do, and that dentistry has changed so much, and that's why I think it's important for seniors to understand that there are a lot of things that can happen to you as you get older that you can fix easily if you get it quickly enough.
It's true.
One of the things I had in my notes here was the importance of recognizing how the care of the mouth interacts with the rest of the body.
Yeah, and I think the big word is inflammation. Everybody's talking about inflammation now. Everybody in the medical side. That in fact we've got this overall chronic inflammation in the body, which results in asthma, which results in bronchitis, which results in Alzheimer's, which results in cancer, which results in heart disease, which results in kidney disease. All of these inflammatory factors, we're talking about anything that's an itis is inflammation. One of the itises that we have is periodontitis, inflammation of the gums and bone that's surrounding the teeth. It's inflammation of that area which causes the teeth to ultimately get loose and come out. And what we're seeing in study after study, looking at one disease in relation to periodontal disease, is that if the periodontal disease is diagnosed and treated, some of the factors and the markers for these other diseases get better. So in fact, we are seeing relationships between gum disease and all of the other inflammatory diseases that I talked about. There was a study that was done by one of the major insurance companies that looked at the prevalence of heart disease in relationship to how often or whether a person got his teeth cleaned. And as a result of that study, they found out that people who get their teeth cleaned on a regular basis, there was a smaller incidence of heart disease. And so now there is some move afoot, and I'm not saying insurance is the be-all or end-all. As a matter of fact, I don't even believe that at all. But the fact is that insurance companies are now thinking about paying for routine dental cleanings because on the other end, there'll be less expenditure on the insurance company's side to take care of a person who might have heart disease.
That's called using technology the smart way.
That's right.
It really is.
Everybody's about saving money. The insurance companies want to save money too.
But when you talked about the relationship of the mouth and everything, I know I'm a heart patient.
Yeah.
And I know that before they work on my mouth, if they're going to do drilling or anything like that, the school of thought has changed a little bit, but some dentists believe this and some believe that. Some believe that you should take antibiotics before. Some say you don't have to do it now.
Well, that belief is gone. I mean, whether they believe it or not, the American College of Cardiology came out with a statement, it was over 3 years ago, saying taking antibiotics to pre-medicate for heart murmurs and things like that is folly. In fact, it's counterproductive, so don't do it. There are a few things that you would do, artificial heart valves, where you would still use that pre-medication. But the other things, actually they found out people did worse over a 60-year period of time that they studied this, where they gave antibiotics for these heart murmurs and mitral valve prolapses and things like that. And they found out, measured the data, that people did either the same or worse as a result of taking the antibiotics rather than not taking the antibiotics. So we can look at all sorts of belief systems, but data is data.
I know, and it's when they told me I didn't have to take them anymore, I was astounded. I said, yeah, but I was told that one of the quickest paths to my heart and all kinds of diseases is through the mouth and through the gums.
Yeah.
But it is true. Yeah. It still is true that the mouth is one of the greatest carriers of disease into our body.
Yes, it is. It is. And the fact is that if we ignore disease, whether it's in your finger or whether it's in your mouth, that disease just doesn't stay here. The body is mobilizing its forces to take care of this problem here or taking care of this problem here. So the problem needs to be addressed. So you just can't ignore your mouth.
But that's really why seniors, if you have a cut, if you have a mouth infection, if you have a tooth infection, you should see about getting it treated as quickly as possible, because as we grow older, our immune system breaks down.
That's true. And in particular, in dental care, getting your teeth examined on a fairly frequent basis. If you have no disease, at least once a year. If you have some disease, every 3 months, sometimes every 6 months. But if you have some disease in the mouth, get it looked at. And if you've had experience with getting lots of fillings and lots of crowns and having gum disease, make sure you're seeing the dentist frequently enough so you don't have that acute infection. Get it diagnosed and taken care of early.
Okay, and talking about periodontal disease, why is it that, or is it that senior citizens, older people, just don't feel the effects of periodontal disease, or they just don't want to admit it, they don't realize it? What is it? Why don't we, as we get older, consider that we are prime candidates for periodontal disease?
Periodontal disease for most people is silent. You don't feel it. You don't know that it's going on.
About, it's like glaucoma of the teeth.
Essentially, yes. It has to be diagnosed, and it's diagnosed with X-rays. That's part of it. But the most important part of it is something called the periodontal probe examination. I know you'll love that. But the fact is that we can take that measuring device and put it between the gum and tooth and know whether there's damage to the tooth or not. It's an excellent way and is the best way of determining whether you have disease or not.
You know, you like to tease me about this, but how about, truly, tell our viewers, describe what this thing is and how tiny it is and how you can take that thing and put it down at the teeth and below the gum and take a look.
Yeah.
We don't think about things like that.
Well, we've got a couple of things. Number one is the probe, and the probe is what's done to diagnose it. But then the item that we've been thrilled with, we bought a dental endoscope about 12, 13 years ago. And a dental endoscope is nothing more than a camera. You know, we do endoscopic surgery for knees and we do endoscopic surgery for female problems. I mean, it's a little scope that's placed into the body so you can look through a camera and not have to make a big incision. Well, they make a scope that's that small that gets between the gum and the tooth. So that if you have gum disease, which means you have accumulations of this hard material called calculus, which is like barnacles in the bottom of the boat, except it's adhering to the root and is causing your gums and your bone to be lost. If you can go below the gum line and see that calculus with the endoscope, then you can remove it. and that's what I
Can you remove it with the endoscope?
The endoscope is only allows you to look at it. Then you use a regular dental cleaning instrument to go under the gum.
Wait a minute. You're telling me that they take that shepherd's hook thing and they go that far down in there?
Absolutely, yes. Now, if you have disease, you should be numb for that. There are some people who don't need to be numb for that, but most people would be numb. But the idea is to try to avoid gum surgery. I mean, seeing me for gum surgery, and this has been great because one of the main reasons we do gum surgery is so we can see this calculus. Imagine, though, if our hygienist is able to go down below the gum line with a scope, and she can see the calculus without my ever doing incisions on the gums. Imagine how happy you would be not to have sutures being placed by me.
Okay. And senior citizens, as we grow older, we tend, I think, Lee, to use the word calculus and plaque interchangeably. They're not. They're not the same thing.
Yeah, plaque will grow whether you eat or not. It's the soft stuff that accumulates around the teeth that you remove with brush and floss. Calculus is a hard substance that you can't remove at all. It needs to be removed professionally.
What is the greatest culprit that attacks older people's teeth that causes them to lose their teeth and have to have dentures? What is the primary cause?
There are two sides. There are actually two primary causes. One is what we just talked about, periodontal disease. And so if that disease goes unchecked, you lose more and more of the bone support for the teeth get loose, and then they come out. So that's one side. The other side is the dry mouth and dental decay side.
Okay.
There are over 500 medications that we commonly take that cause your mouth to be dry. If your mouth is dry, it becomes acidic, has acid in it.
Right.
What eats away at teeth? Acids. And so we tend to form this tooth decay, particularly around exposed roots. And as we get older, some of the roots sometimes become exposed, and they're extremely difficult to treat. It's extremely difficult to put a filling in an exposed root. And if your mouth stays dry, no matter how well the filling is placed and how good the dentist has been able to control that part of it, then you're still prone to getting recurrent tooth decay around the existing filling. It becomes a big, big problem. And so it's important the mouth be kept wet. It's important the mouth is kept non-acidic so that you can help prevent this problem of root caries.
You hit a trigger point. A trigger point, and this is not a trigger point here that's causing a headache up here. This is a trigger point that's triggering what's below in that cranium. It's my brain. I think that you talked to me at one time on one show or between shows about a patient you had that had something like this, and you gave them CoQ10?
Yeah.
Was it for this thing we're talking about now?
Well, I think it's important because CoQ10 is nothing more than a vitamin, or it's like a vitamin. And CoQ10 goes directly, and by the way, the body manufactures CoQ10.
Yes,
and like anything, as we get older, we manufacture less and less CoQ10. But CoQ10 is important for the energy producing part of each cell. It literally feeds on it. And so if we have a reduced amount of CoQ10, the cell doesn't work as well, and therefore it doesn't heal as well. What's the primary medication that drives up to 50% of CoQ10 out of the body?
A statin?
Statin drugs, that's right. So a cholesterol-lowering drug drives 50% out. And so your ability to heal may be impaired as a result of the cells not having the energy to heal. And so
wait. You're saying that you take statins to reduce cholesterol?
Yeah. So in this case, the statins do cause dry mouth, but in this case, we're talking about it actually driving CoQ10 out of the body.
Right.
So the CoQ10 is no longer there. So we're talking about a patient discovery. So I did surgery on a patient, and I saw, don't even remember if it was a male or female, but I saw him or her a week later, 2 weeks later. It just wasn't healing correctly. This was 25 years ago. I said, I've got this thing on my shelf. Take some CoQ10, and let me see again in 2 days. I saw the patient again in 2 days. The gums are totally healed. What does that mean? It means that patient apparently had a deficiency in CoQ10. And it may have been that patient was on a statin drug. At that point, we didn't even know the statin drugs drove CoQ10 out of the body. So we gave the supplement, the gums healed. It happened on another patient 2 or 3 weeks later, same thing. And so now the routine is for anytime we're doing periodontal surgery in a patient or dental implant surgery in a patient, or we're making an incision, I make sure that patient has adequate levels of CoQ10 as part of the pre-op recommendations.
He's telling the truth, folks, because he gave me a bottle of CoQ10 that was about that tall and about that big around.
Do you exaggerate at all?
No, I didn't exaggerate. In fact, you had me take 3 a day.
Yeah.
And there was enough in that thing, about a month and a half.
Good.
And I took every one of them.
You healed very well.
I did heal. And, well, I healed so well, folks, that when Dr. Sheldon, we're talking about senior citizens, and one of the things we have as we grow older is a recession or a loss of bone in our gums.
Right.
So you found that I had, when you extracted the 2 teeth, that I already had 2 of them out, but you took 2 more out, and you mixed some of my blood with a substance you had that you put down in there, and it grew bone.
Correct.
It grew bone.
Yeah.
In fact, I grew so much bone that he had to go back in and surgically remove some of that bone before he could put my implants in, because there wouldn't be enough clearance between the bridge and the gum.
It's a good problem to have.
It is a good problem to have.
Yeah.
But it points out, Lee, that it's the topic today, dental care for seniors.
Yeah.
There's so much the seniors can do. There's so much available today to take care of our mouth. And another thing is that, we always talk about flossing.
Yeah.
Every show. And it's something we always inevitably get to, because you use a thing that if you just brush the front part, you're missing about 60% between the teeth.
You
right?
learn well.
I learned well. I read your book. I read your book. Doing shows, if you're giving information out to people that they believe and understand, it's fun to do.
It is.
It really is. And that's why I like doing shows, because everything we talk about that you've discussed in your book is important, but flossing the teeth is important. And I realize that. And I wish that more people did realize the significance of brushing and flossing and regular dental care.
Me too. But at the same time, more people are flossing. Because if you go to the drugstore, one thing that people don't like about flossing is you got to pull out this piece of string, and it should be about 18 inches long. And then I wish I had some floss here, but you get the idea. I'm winding the floss around my fingers, and then I'm directing the floss with my fingers between the teeth.
I like to do that.
Well, you're weird.
I'm weird.
Most people don't. And so what they've developed is this little disposable plastic fork that has about an inch of floss between it, and you just place that between the teeth. You don't have to use 2 fingers. You can do it while you're watching TV or doing other things, and not have to have this, this dexterity
I'll be honest with
problem
you, and I'll bet you, if you're honest with me,
I'm honest with you, yes.
That little thing that's got there, you cannot get the same pressure on that against your teeth to take the plaque off if you're doing flossing the right way.
I would beg to differ with you, sir.
Okay, I'm going to get.
You want to have a floss off? Is that what you want to do?
No, not on television. It'd be very embarrassing. But
I'll have my hygienist come. We'll measure.
Seriously.
Neither of us will brush our teeth for 3 days.
How can you?
And then she'll measure our plaque, and then we'll floss together, and we'll see whether you do better with your fingers or I do better with my little fork.
I just don't know how you can get the pressure with the fork that you can get by the floss, especially. I like it after I do it with the single, I like to do the double, and pull it against either side of the tooth to try to loosen the plaque.
I'll go that far with you. You can probably get more pressure with your fingers than you can with a fork. The question
That's what I was talking about.
Right, the question is, how much pressure do you need to get the plaque off?
Well, I know, and I have to tell you honestly, because I called you, I thought I'd done something to my teeth. I learned that by putting more pressure on the floss, you remove plaque that you didn't know was there.
Well, yeah, you removed calculus from down here.
Was that calculus?
Yeah.
Okay.
Yeah, you were trying to put my hygienist out of a job, I beg your pardon. But yes, you did a good job doing that.
Okay, you didn't tell me it was calculus I was taking on.
It was the hard stuff. And it felt like you had lost some tooth structure.
Yeah,
it wasn't tooth structure at all. It was calcified calculus. And by the way, this calculus is not one that really causes disease or unless it accumulates in a lot of bulk. And it's the typical calculus they have behind your lower front teeth. And that comes from your salivary ducts, which happen to be located in that same area. So you have the saliva continually feeding that area. And the saliva has calcium in it. And that calcium is laid down as a deposit on the backside of your teeth, just like silt being carried down the Mississippi River is deposited in the delta.
But it brings out a point.
What's that?
It brings out a point.
Yeah.
If you do floss, whether you do it with your fingers or that contraption, if you do it and you try to do it well, that I'll bet you that many of us, as we grow older, if we just did that simple thing every day, we could do a heck of a lot to improve the overall condition and care of our mouth. So if we do that, correct brushing, and use the right kind of mouth rinses. And I have never asked you, is Listerine a good mouthwash? I don't.
Are we on commercial television? Should I talk about that? Listerine actually does reduce bacteria in the mouth, and yes, it is a good mouthwash. But the important part is what you said first. First of all, my healthiest patients are the ones who do exactly what they say. And I'm a gum disease practice, so that's what we see. And we see that people who take care of their mouths have less bleeding, shallower pockets, if there are any pockets at all, because of the amount of care that they're applying to their mouths.
Right.
But the important part is the mechanical pressure that you place. You need enough mechanical pressure to be able to remove that plaque just once a day. And so on the outside and the inside, that's done with a brush. Between the teeth, that's done with a floss, or with something called an interproximal brush, a brush that goes between the teeth. If you just do that, you're going to minimize your expense in my office, I guarantee you. And all you have to do is spend 5 minutes a day. It has nothing to do with brush your teeth 3 times a day after every meal. It has nothing to do with that whatsoever. You're you're removing plaque. And plaque is going to be there whether you eat or not. And whether you brush and floss at 11 in the morning or 8 in the morning or 11 at night, as long as you get that plaque off once a day, you're going to have a lot less gum disease and a lot less need for any dental treatment.
What else? I mean, we talked about. The other thing is that, if you're quick, the use of inhalers.
Yeah.
For seniors, a lot of senior citizens use inhalers.
Yeah.
What does that cause?
Actually, you've got accumulation of the inhalant on the gums. They're going to cause some gum irritation. Just rinse your mouth out for 30 seconds and just get rid of it.
Okay. Thank you, Lee. Thank you for watching today's episode of Focus on Seniors. If you have a question or a comment, please call radio station WMEL 1300 AM at 321-631-1300. For more information on senior care and resources, visit our website, helpingseniorsofbrevard.com. Thank you for watching today's show, and please tell others about all the shows you'll see on our networks. Thank you.